Good afternoon, my name is Beatriz. I'm a master's student at the School of Dentistry of Aracatuba, UNESP, and today I'll present half of my master's research entitled Evaluation of Antimicrobial Photodynamic Therapy and Calcium Hydroxide on Glass Fiber Pulse Luting Interface. So the photodynamic therapy involves the photoactivation of a photosensitizer using a specific wavelength of light in the presence of oxygen, and this interaction produces cytotoxic species such as singlet oxygen that leads to oxidative stress and microbial membrane rupture. And this therapy, when combined with the conventional ones such as biomechanical preparation, intracanal medication, and sodium hypochlorite irrigation, can enhance the decontamination of the root canal system. So the aim of my study was to evaluate the impact of APDT using different photosensitizers, andesine green, curcumin, and methylene blue, combined with intracranial medication with calcium hydroxide on the adhesive interface between resin cement and intra-articular dentin. We used confocal fluorescence microscopy to evaluate the adhesive interface and micro-CT to quantify the presence and volume of the bubbles in the resin cement. We used 72 bovine incisors divided into 8 groups, and the protocol included removal of the anatomical crown of the teeth, biomechanical preparation, and apical sealing. The groups were G1 and 2 that only received the biomechanical preparation and irrigation with deionized water, and only G2 received the intracanal medication. G3 and 4 received the biomechanical preparation and the photoactivation using the cyanine green for 60 seconds, and only G4 received the intracanal medication for 14 days. G5 and 6 received the preparation, and the photosensitizer was curcumin, activated for 300 seconds, and only G6 received the intracanal medication, and G7 and 8 was performed using by methylene blue for 180 seconds, and only G8 received the intracanal medication. After 14 days of the calcium hydroxide action, the root canals were filled with good aperture cones, and after that, the fiberglass poles were fixed using a dual-core resin cement, and 48 samples were evaluated using micro-CT to assess gap formation and bubble volume, and 24 samples were evaluated using confocal fluorescence microscopy. Our results showed that groups treated with andesine green and curcumin had more defects in the adhesive interface, presenting greater gap formation between the resin cement and dentin and higher volume of bubbles within the cement. However, the group treated with methylene blue and calcium hydroxide showed superior results, presenting less gap formation and lower volume of bubbles. For the quality of the adhesive interface evaluated using the confocal fluorescence microscopy, there was no statistical difference between the groups and the thirds analyzed. So one important thing is that even with the different techniques that we have for removing the calcium hydroxide, such as the conventional irrigation, the passive irrigation with ultrasound, and agitation with physically, none of them were able to remove the medication, and it may influence the adhesion and penetrability of resin cement in tubules. And secondly, is that each of the photosensitizers behaved differently. The andesine green has a different mechanism of action. It produces a photothermal reaction and not a photochemical reaction, and it may lead to a chemical and physical alteration of the intraradicular dentin, leading to the appearance of gaps and bubbles in the resin cement. The curcumin, activated by blue lead, leads to hydrogen peroxide production, which interacts with hydroxyapatite and forms a precipitate. And this precipitate can act as a physical barrier to bonding, affecting the luting process. Methylene blue, on the other hand, demonstrated better compatibility with dentin and more effective microbial reduction, resulting in fewer defects in the adhesive interface. In conclusion, the photodynamic therapy with andesine green and curcumin negatively influenced the quality of the adhesive interface between the resin cement and the intraradicular dentin. Meanwhile, the methylene blue, as a photosensitizer, combined with intracanal medication, showed better results, presenting lower quantification of gaps and lower volume of bubbles. These are my references that I used to produce my research, and thank you for your attention, and I look forward to all your questions.